What if the word obesity is doing more harm than good? What if the name itself is holding back real change, real care, and real understanding? And here's the bigger question: what if changing that one word could change lives? Hello everyone, my name is Christopher Durham and this is the Downsized. If you're new to our channel, welcome. My wife Laraine and I have been on a GLP-1 adventure that has completely changed our lives. We've lost more than 150 pounds together using GLP-1s. I've personally lost over 100 pounds. But here's the thing, losing that weight didn't make the stigma go away. The word obesity still carries a sting, and lately a few of you in our community have challenged whether obesity is even the right name for this disease. And that got me thinking, has the name run its course? Is it getting in the way of better care, or even better science, or even better understanding from the world at large? Because as powerful as these medications are, we still live in a world that misunderstands the disease we're treating. And words, they shape everything. They shape our care, they shape our insurance coverage, they shape our laws, they shape our dignity. I remember the first time I saw the words morbid obesity printed about me. It was startling because it was so out of place. I didn't expect to see it coming. I'd gone in to see a doctor during COVID because I had an ear infection, so bad pain in the ear. My normal doctor was not there that day. Of course, everybody's masked up and all that, but it's COVID. I'm probably 300 pounds plus. And the doctor comes in, checks me out, checks my ear. She's very curt, kind of abrupt, polite, but not overly so. I thought, it's COVID, people are distant, that's fine. But the bedside manner was certainly lacking, and the timing was very short. She just wasn't giving me a whole lot. So she wrote me a prescription for the ear infection. I go and get it filled. I come home. Lorraine's there. Laraine loves the whole My Chart app. So she was reading what the doctor had put in. And the very first words that the doctor had put in about my ear infection were morbid obesity. Now, what morbid obesity had to do with my ear infection, I have no earthly idea. But honestly, I knew I was fat. You didn't have to, nothing surprised me. I'm old, I'm fat, I'm bald. There's a lot of things going on there. It never occurred to me that this term morbid obesity was there. And it shocked me to my core. And honestly, it was one of those things that really set us on the path to GLP-1s. I tell a lot of stories about it, but that was certainly one of the pieces. Today I'm going to unpack the word obesity, where it came from, what it leaves out, and why letting it go could open the door to more compassion, hopefully more access, and even better yet, better outcomes for millions of people who are suffering from this disease. Let's start with history. Where did the word obesity come from? Because words aren't neutral. They carry judgment, assumptions, and meaning we rarely question. The word obesity comes straight out of Latin. The root is obesus, O-B-E-S-U-S. And here's what that literally means: having eaten until fat. That's it. Not a hormone, not a brain pathway, not the name of a doctor who studied it, not the part of the body it affects. Just a label that assumes indulgence, eating too much. That single word baked in blame from the very beginning. For centuries, it framed the disease as a failure of willpower, appetite, or morality. And that's exactly the stigma we're still living with today. Compare that with how other diseases got their names. Diabetes comes from the Greek for siphon, describing how the body loses fluid. Hepatitis literally means inflammation of the liver. Even cancer comes from the Greek word for crab, because tumors were seen as crab-like, spreading their claws. But obesity, it just says you ate too much. That's not biology, that's not science, that's blame dressed up as medicine. And here's the truth, you and I know it. Obesity is not about indulgence. It's not about gluttony. It's not a moral sin. It's about disrupted weight regulation, altered brain chemistry, hormonal imbalance, and a body that fiercely defends its highest weight. GLP-1 medications work not because people suddenly have more willpower, not because they're suddenly more moral or better people, but because the medications change the biology. So when we use the word obesity, we're repeating a label that has carried stigma in its very definition for over 400 years. That raises a serious question. If the word itself has been corrupted by judgment, maybe it's time to just leave it behind. Maybe we're done with that word. So if the very root of the word obesity comes from blame and indulgence, it's worth asking, how do diseases usually get their names? And why does this one feel so different? Why does it feel so personal? The names of diseases are not random. They usually come from one of a few places. We start, of course, with people. So there's Lou Gehrig's disease, Alzheimer's, Crohn's, Parkinson's, Graves', Hodgkin's, named after a famous person or a Doctor Who discovered. Or places. Lyme disease is named after Lyme, Connecticut. Ebola from the Ebola River. Rocky Mountain spotted fever, of course, from the Rocky Mountains. The next category is what disease affects. Hepatitis means liver inflammation. Cardiomyopathy is disease of the heart muscle. Nephritis is kidney inflammation. And sometimes names evolve when understanding improves. Consumption became tuberculosis. Manic depressive illness became bipolar disorder. Adult onset diabetes became type 2 diabetes. These changes are not cosmetic. They reshape how society sees a disease and how doctors treat it. Now let's look at one of the most common and misunderstood diseases on the earth, obesity. Let's go back. Where did the word come from again? Well, Latin, obesus. Remember, having eaten until fat. That's it. Not a hormone, not a researcher, not a brain region, not a place, not the first person who got it, not a famous person, just a label pointing the finger at indulgence and excess. And yet it's the word we use for a medical condition impacting hundreds of millions of people, including nearly every one of us using GLP-1s today. This is exactly the challenge being taken up by the Lancet Diabetes and Endocrinology Commission on the definition and diagnosis of clinical obesity, a global task force of 60 experts, including people with lived experience. So people who are actually overweight. Its chair, Francesco Rubino of King's College London, says plainly, the word is so stigmatized with so much misunderstanding and misperception, some might say the only solution is to change the name. The word obesity leaves out everything important. It doesn't say anything about the hypothalamus, the region of the brain that regulates appetite and satiety. It doesn't say anything about hormones like GLP-1, GIP, or amylin, signals that tell us when we're full or satisfied. It doesn't say that in people living with obesity, these systems often aren't working the way they should. It doesn't tell you that the orbitofrontal cortex, a key part of the brain's reward system, lights up with food cues like a light show. It says nothing about the food noise that haunts my brain, or that the body defends the highest weight with the same intensity it defends against starvation, even when that weight is damaging health. And yet the name we've carried for centuries reduces all of that complex biology to one assumption. You ate too much. GLP-1 medications don't work because we suddenly tried harder. They work because they changed the biology of weight regulation. As Dr. Margaret Steele from University College Cork explains, the word is too widely associated with negative connotations. She argues that this isn't just about fat tissue. It's about disrupted brain pathways, hormones, and an environment that conditions us toward overeating. And yet the word obesity tells none of that story. And that stigma, it doesn't just hurt feelings, it changes care. Globally, both the World Health Organization and the World Obesity Federation recognize obesity as a chronic disease. The World Obesity Federation's 2023 statement made it clear. We need to stop talking about obesity in terms of body size and body weight. They define it as a condition of excess or dysfunctional fat tissue that impairs health, something that should only be diagnosed with a medical assessment. But despite these official definitions, stigma lingers even in healthcare settings. Dr. Ximena Ramos-Salas, a leading researcher on weight bias, warns, disease states do not define who a person is. Until we get over the internalization of this weight bias, it's going to be very difficult to address obesity. And we see the effects every day. Patients with obesity get shorter appointments, they get fewer tests ordered, they get brushed off with just lose weight instead of real treatment. You know, diet and exercise, less food, or work. And too many delay going to the doctor at all simply to avoid being shamed. So a quick question for you watching. If you've hung in this long, has a doctor ever dismissed your health concerns just because of your weight? If so, drop a comment below. Sharing those stories helps people see how widespread this is. So imagine if cancer had been named rotting sickness. Would insurers cover chemotherapy? Would doctors treat it with urgency? Would patients be viewed with compassion? That's the absurdity we're living in with the word obesity. It's not just the name that's outdated, the way we diagnose it is too. For decades, BMI has been the go-to measure, but experts increasingly agree it's crude, misleading, and often harmful. That's why the European Association for the Study of Obesity, or the EASO, recently proposed a new framework. Instead of BMI alone, they recommend looking at how fat is distributed in the body and whether it's causing metabolic harm. One key measure, waist to height ratio. If your waist is more than half your height, the EASO says that's a better predictor of health risk than BMI. Dr. Luca Bassetto, who helped to develop the framework, explains to concentrate only on the problem of weight on the scale is a mistake. This matters because diagnosis shapes treatment, and right now too many people are either misdiagnosed or ignored altogether because BMI doesn't tell the full story. Not everyone with a high BMI has metabolic disease. Not everyone with a normal BMI is metabolically healthy. And yet the same name, obesity, tied so tightly to size and scale, reinforces the wrong focus. Professor John Halford of the University of Leeds adds another layer of complexity. He points out that the patient and research community has largely accepted the word obesity, despite its baggage. Changing it, he warns, could risk slowing scientific momentum. Now, I don't know about that. The scientists are still going to take the research dollars. They're still going to work on it. It's still 74% of Americans have overweight or obesity. The market's too large. Changing the word's not going to slow it down. Dr. Bassetto pushes back, arguing that the real battle is against stigma, not inertia. So here we are, a disease defined by a name that blames indulgence, diagnosed with a tool that doesn't measure health, and treated with a level of stigma that scares people away from care. That is why this conversation matters. We've seen this movie before, and every time the lesson is the same. When the name changes, the care changes. Take type 2 diabetes. It used to be called adult onset diabetes, but then kids and teens started being diagnosed. The name became misleading and dangerous. Parents and doctors weren't catching it early enough. Changing the name to type 2 diabetes wasn't just cosmetic. It removed judgment, improved diagnosis, and got kids into treatment earlier. History shows us this. Names matter. They frame how society understands disease. They determine whether people get compassion or condemnation. So why are we still using a 400-year-old word? It literally means having eaten until fat to describe one of the most complex and biologically driven diseases on Earth. Researchers and medical societies have been wrestling with this problem. Here are a few names that have been proposed. Number 1, adiposity-based chronic disease, ABCD. Proposed in 2016 by the American Association of Clinical Endocrinology. Scientifically precise, but as Dr. Rubino notes, it speaks to scientists and medical professionals. I don't know how much it would appeal to the general public. Number 2, metabolic dysfunction associated disease. This one shifts the focus away from size and towards system-wide dysfunction. Number 3, weight regulation disorder, a plain language term that describes the real biological problem. Some bodies fiercely resist maintaining a lower weight. Number 4, neuroendocrine weight disorder, a mouthful but accurate, highlighting the hormones and brain circuitry at the heart of the disease. None of these are perfect, but all of them are better than a word rooted in indulgence and shame. Naming is only one part of the picture. Diagnosis is evolving too. As we saw with EASO's waist to height ratio, the science is moving forward. The question is, will the language keep up? So let's imagine something together. What if your doctor's chart didn't say obese, but instead said weight regulation disorder? How different would that feel when you're sitting in that exam room? What if insurers couldn't hide behind the stigma of the word obesity to deny coverage, and instead had to acknowledge a clear medical condition? What if the conversation between you and your doctor shifted from blame and lectures to biology and treatment? Think about it. A new name could change the way patients are treated in the exam room, the way insurers decide coverage, the way legislators write policy, the way society understands one of the most common diseases in the world. Because words aren't just words, they're frameworks. And when the framework changes, everything else follows. So here's where we land. If you're taking a GLP-1 to treat this disease, you already know. This is not a diet. This is not a shortcut. This is medical treatment. And the language we use matters. Naming matters because we matter. You and I matter. A better name could reduce stigma, improve communication with doctors, help insurers cover these medications, and push for policies that treat this disease like the chronic condition it is. But naming is only the beginning. We also call for action. We call on the manufacturers to be heroes by making these medications more accessible and more affordable. We call on legislators to be heroes and rethink the system, not as a moral failing, but as a medical condition that deserves care. They must build a system that improves healthcare and well-being for everyone. That's real heroism. And with the renaming of obesity, we call for something even bigger, a shift in thought, a shift in approach, a shift in attitude, one that empowers every one of us to be the hero in our own story, one that makes all the medical tools available at an affordable and accessible price for everyone who medically needs them. Because ultimately, you are the hero. We are the hero. So I'll leave you with this question. What do you think this disease should really be called? Drop a comment below. We want to hear from you. Because this isn't about semantics. This is about how we treat people. Obesity isn't just a label. For too long, it's been a barrier, and changing it could be one of the most powerful things we do. Not just for our bodies, but for our dignity, our access, and our care. If you haven't already, please take one moment and like this video, subscribe, and share it with someone who needs to hear this. Share it with someone who is fighting the disease of obesity. My name is Christopher Durham, and we are the Downsized. I'll see you next time.